The US faces a crisis in male suicide with rates very high, 4 times higher among men than among women, and rising especially quickly since 2010 among young men. In 2022, we lost 40,000 male lives to suicide and then another 10,000 female lives. This is a big part of the mental health crisis that we see playing out, and it's one that's not getting enough attention, at least not yet. There's a higher risk of suicide among various groups in the US, and we need to pay attention to those gaps. So, for example, there is a higher suicide risk among older Americans, those who live in rural areas, for Native Americans, and for veterans. But the biggest gap of all is between men and women. Suicide rates have ebbed and flowed over the last half century, as you can see here, but really risen since the late 1990s. There's been a 40% jump just in the last few decades. And whilst these are rates, that doesn't really tell the whole story about the scale of the problem. There's 40,000 male deaths a year at current rates. And that means that there's a man dying from suicide every 13 minutes. And if the male rate of suicide had been the same as the female rate of suicide since 1999, then there would have been more than 500,000 fewer male deaths from suicide. And just to put that in perspective, that's about half the number of people that we've lost in total to COVID since the pandemic hit. So the scale of the numbers here is really quite significant. This is a major public health problem, and one that is growing. But there are some important differences here by age and by race and by geography, even across gender. And so the highest suicide rates are among older men, and that's also where we see the biggest gender gap among the over 65s towards the top end of the age distribution. There are also some pretty big differences by race, that the highest suicide rates for both men and women are among American Indians, where the rates are considerably higher than they are for other racial groups. Although we do also see pretty high suicide rates among white men as well, and a gender gap consistently across those different racial groups. And there are differences by area as well. One of the most striking findings from the suicide research is that men who live in rural areas are at considerably higher risk of losing their life to suicide than those who live in urban areas. And there are differences across states as well. Interestingly, the rise in male suicide has differed by age across different time periods. So between 1999 and 2010, you can see that most of the rise in male suicide was really being driven by middle-aged men, which is consistent with the story about deaths of despair and what was happening in the economy generally. But since 2010, the story's really changed quite significantly. You can see there's been a rise among older men, among the over 65s, but the really big increase since 2010 has been among younger men, where there wasn't really an increase before then. And so over the last decade or so, it's been young men that have been fueling the rise in suicide. And so if you take the 25 to 34-year-old age group, for example, there's been a pretty staggering 34% increase in the suicide rate just since 2010. So we have to think about age as well as trend. Behind all of these charts, there are, of course, thousands of individuals whose lives have been shattered by suicide, not only the lives lost, but of those around them, their family, friends, and communities. This is a public health tragedy that is unfolding before our eyes. But there's a lack of awareness sometimes around the issues of male suicide specifically. Of course, there are suicides affecting the lives of men and women, but with a fourfold difference in the risk. It is very important that we understand that this is something that does affect men, and increasingly young men specifically. Any good preventive healthcare approach has to start with awareness. And so just building understanding of the scale of this challenge is step number one. And that's something that we at the American Institute for Boys and Men are committed to doing in the years to come.